This is the first of 5 videos on inflammatory bowel disease and will discuss general management. Inflammatory bowel disease is a condition that mainly affects the intestines and sometimes other parts of the gut. It is an immune-related condition. Normally, a healthy immune system usually fights infection, but in this immune-related condition, the immune system attacks healthy tissue. The immune system mistakenly thinks that the gut is foreign and begins to attack it, causing recurrent inflammation. There are two types of inflammatory bowel disease, namely ulcerative colitis and Crohn's disease. The image of the colon shows Crohn's disease on the right side and ulcerative colitis on the left side. Crohn's disease can affect any part of the gut, but in nearly 80% of patients, it affects the end of the small intestine as is noted here. And in 50%, the large intestine is also affected as shown by the red areas here. The lesions are called skipped lesions because as they are areas of inflamed tissue followed by areas of normal lining. Ulcerative colitis only affects the large intestine and almost always the bottom part called the rectum is affected and in a continuous way as is shown by the red color. It can affect any length of the colon starting from the bottom and spreading to the top. Both these conditions are chronic and can go on for years and even a lifetime. Both these conditions are chronic with cycles of flare-up or relapse where there is worsening of the inflammation with symptoms and the patient is sick, and remission where the inflammation lessens, the patient is well with no symptoms. So this cycle can go on and on. There could be periods of flare-up or relapse lasting for a few months or longer if it's not treated, followed by remission, which can go on for months and years. There is no cure for inflammatory bowel disease, but medicines can control the disease. If medicines do not work, surgery might be needed, particularly in Crohn's disease. Risk factors which puts a person at an increased risk of getting inflammatory bowel disease include genetic factors with first-degree relatives, meaning parents, children or siblings, have a 3 to 20 times increased risk of developing the condition. Age of onset is usually from 15 to 30 years, although it can present at any age. Smoking increases the risk of Crohn's disease, but not ulcerative colitis. Low levels of vitamin D seem to play a part. A diet high in fat, animal fats, and polyunsaturated fats, particularly high omega-6 fatty acid ratio to omega-3 fatty acid, seems to play a role. Food poisoning, particularly due to the bacteria, Salmonella and Campylobacter. Bacteria in the digestive tract may mistakenly cause the immune system to attack healthy cells. Stress increases the risk of a relapse. And finally, lack of sleep increases the risk of the onset of ulcerative colitis and flare-up of Crohn's disease and ulcerative colitis. Let's now talk about the general management of inflammatory bowel disease. The more specific management will be discussed in the subsequent videos. Firstly, regular exercise helps in well-being. Avoid painkillers like NSAIDs as it may worsen symptoms. Avoid foods that trigger symptoms. Food intolerance to cereals, lactose and yeast are common. Lactose intolerance is common, so avoid lactose-containing foods and see whether it helps. It is particularly seen in disease of the ileum. Some studies have shown that a low FODMAP diet improves certain gut symptoms and health related to quality of life. High FODMAP foods are large carbohydrates that many people cannot digest. Please see the video on FODMAP. Limit processed foods and artificial sweeteners. Ensure adequate calcium 1000 to 1200 mg per day and vitamin D at least 600 international units per day. Normal fiber diet unless there is narrowing of the intestine. Vitamin and mineral supplements if blood tests show a deficiency. Nutritional supplements are generally not needed if the patient has a well-balanced diet. Ensure adequate sleep as lack of sleep increases relapse or flare-up of inflammatory bowel disease. Manage stress as it increases the risk of relapse. Probiotics are not proven to help, although there are some ongoing studies regarding specific benefits of probiotics in ulcerative colitis. No evidence that a low carbohydrate diet, fish oil or antioxidants help. What steps can a person take to prevent flare-ups? If Crohn's disease, stop smoking. Even passive smoking may cause flare-ups. Eat a healthy low-fat diet. Exercise regularly. Sleep well. Manage stress. Be compliant with medication to prevent relapses.